everyone. Thanks for joining us today for this very important lecture. And we are very happy that we are able to get two experts from the emergency room to come and talk with us. I am Diana Lau, the Director of the Asian Health Institute at UCSF. 歡迎各位參加我哋今日嘅健康講座。咁咧呢個就係雙語嘅講座，係用廣東話同埋英文講嘅。咁咧今日我哋嘅題目咧就係講急症室啊，點樣用佢去到應該知道啲咩嘢，同埋幾時係去，幾時係唔應該去急症室。呢啲好重要嘅問題咧，我哋今日都會講嘅。咁我哋今日咧係好高興請咗兩位喺急症室做嘅醫生嚟同大家一齊傾偈嘅。咁咧我就係劉淑燕，係呢個加州大學舊金山分校亞裔健康研究院嘅主任。多謝你哋參加。咁今日呢兩位醫生咧就係一位咧就係 Dr. Ravin， 一位咧就係 Dr. Kwan。咁Dr. Ravin 咧就下半部咧就會嚟同我哋一齊參加。咁而家首先咧就由 Dr. Kwan 開始。For our lecture today, we have two emergency room experts here with us, and Dr. Elizabeth Kwan is the first one who will be talking with us. Dr. Kwan is the Associate Professor at the UCSF Department of Emergency Medicine in the School of Medicine. And then Dr. Maria Ravin is the Chief of Emergency Medicine, and she's also the Vice Chair of the UCSF Department of Emergency Medicine at UCSF Health.
My name is Liz Kwan. I am honored to be invited to speak to you. I wanted to say, first of all, that the ER can't replace primary care. And it's very difficult if you don't already have a primary care provider at times to get one. But primary care providers are so important, and everyone should have one. So your primary care provider has special training in preventive care, and they get to know you and your family and monitor your medical issues over time. And they can coordinate your care across different specialties. So there's somebody looking after you, your whole person. They also manage your medications and make sure that you're healthy and that all of your medical problems are managed. So if you don't have a primary care provider, it may take some time to get one. The easiest way to do it is to look on the back of your insurance card if you have insurance to make sure you have somebody in your network. But if you have no insurance, be reassured that every county has clinics to provide care, and there's different nonprofit clinics as well. In San Francisco, it's the San Francisco Health Network and the Department of Public Health Clinic. So a lot of opportunities to get a primary care provider.
千祈唔好用急症室咧代替咗你應該去求診嘅嗰啲基礎保健醫療嘅醫生，因為我哋每個人咧如果有保健咧，都應該有一個同我哋去睇平時嗰啲唔係急症室嘅嘢嗰啲醫生咧，嗰度我哋就叫基礎保健嘅醫療醫生啦，英文咧就叫 primary care。呢個醫生咧，佢哋係受過一啲特別嘅培訓啊，知道有啲咩嘢係要 check 住你啊，尤其是你有啲醫療嘅問題啊，係點樣長期幫你監控啊？呢啲係嗰個急症室嘅醫生唔可以同你做嘅，因為佢哋冇嗰啲咁嘅時間。咁而且咧，當你有不同嘅病嘅時候啊，有心臟病咧，有糖尿病咧，有乜乜乜病啦咁就即係不同嘅專科嘅醫生可能要大家走埋一齊要做個協調。依個有俾啲咩藥你食啊，嗰個俾啲咩藥你食啊，依個做啲咩檢查啊，乜乜乜啊咁呢啲咁嘅協調咧，都係由呢個基礎嘅保健醫療嘅醫生嚟同你做嘅。咁你千祈唔好指意急症室嘅醫生會同你做呢啲嘢，你入去睇急症就係醫你個急症，你急症完咗就請你翻屋企噶啦。咁而且咧呢個醫生咧就會將你全盤嘅藥物咧係一齊做個清單睇一睇，睇有啲咩藥物係重疊啊、多餘啊或者諸如此類。咁所以一個基礎嘅保健嘅醫生咧係非常之重要。但係如果你冇保健咁咪點咧？關醫生咧就提醒我哋，你冇保健咧，我哋尤其是三藩市咧，都係有一啲特別嘅醫務所咧係可以同你做呢啲基本嘅診斷啊醫療嘅。所以咧，你如果係冇保健咧，可以去都可以去有呢個咁嘅保健醫生嘅。咁如果有保健嘅咧，咁喺嗰張卡嘅背後嗰度咧就有你個保健公司嗰啲名啊，甚至將你嗰個保健嗰個醫生嘅名都寫埋嗰度嘅。咁如果你唔知道邊個，你或者睇一睇你嗰個醫療卡就可以知道噶啦。
So the whole idea of having an emergency department is that sometimes delays in treatment can lead to more serious consequences. So there are time-sensitive conditions that require urgent and emergent care. It's really hard to know or expect people to know when they're having these time-sensitive emergencies. So we're going to go over some of the signs and symptoms of when you might suspect that you need to go to the ER.
咁點解要有呢個急症室咧？因為咧有時啊，我哋有一啲嘅症狀咧，如果係遲咗去得到醫療咧，係可能會變差嘅，或者有生命危險嘅。咁喺呢個咁嘅情形嘅時候咧，咁我哋咧就有呢個咁嘅急症室，你係可以去係防止你嘅情況變差或者有生命危險。
It isn't realistic though that in this one lecture we can really differentiate and you will come away knowing that you have to go or you don't have to go. But these are some things to think about. Another plug for a primary care provider is that often your primary care provider office will have telephone advice or some ways to guide you. You might be able to get an appointment sooner to get some more guidance over whether or not this is something that can be taken care of in the office or that you need immediate care for. So that's another big plus about having a primary care provider.
咁啊，關醫生都講得好啱嘅。咁我哋喺一堂咁短嘅時間嗰度，真係唔可以教晒你所有嘅嘢，真係教到你去做醫生咁，自己去診斷到幾時可以去急症室，幾時係唔需要去咧咁。咁咧關醫生咧就提翻我哋即係其實如果我哋係有個保健嗰個醫生嘅咧，我哋係可以將個情形同個保健醫生講，即係打個電話去啦。咁咧等佢嚟到幫我哋，即係要點樣做咯。咁就算係夜晚啊，或者係一啲佢唔喺嗰個診所嘅時間咧，你都可以打電話去嘅，因為佢哋應該係有一個星期7日24小時嗰啲服務嘅。
So some examples of time-sensitive emergencies include heart attacks and strokes when your heart or your brain are not getting adequate blood supply, significant traumatic injuries, or severe infections. Getting these taken care of sooner is very important. Recognizing signs and symptoms of emergencies can help you get appropriate care for you and your loved ones. But again, just a disclaimer that this list can't really represent every sign or symptom. And you are not expected to know, whether or not you're having an emergency based on this lecture. If you have doubts about whether you're having a medical emergency, you can seek medical care from your primary care provider, call 911. It's going to depend on the patient's condition and, your resources. If you don't have an easy way to get in touch with your primary care provider and you're not sure, it's safer to seek medical care. And we are available to you 24/7.
關醫生咧就首先就繼續係提醒我哋咧，就係話其實就係因為你哋嚟參加咧，即係都唔係好似我講得咁簡單嘅，就係話你就可以知道幾時去，幾時唔使去呢個急症室噶啦。咁佢嘅意思咧就係話你係可以知道一啲，但係我哋係唔可以係喺呢個咁短嘅時間之內教晒你全部嘅嘢啦。咁大家都應該好明白嘅。咁但係有幾種情況咧，你就應該知道咧，呢啲情況咧就多數都係同個時間去爭取時間有關嘅。一個就心臟病發作啦，一個就中風啦，一個咧就嚴重外傷，譬如車禍或者俾人開槍打親啊，或者俾人吉親啊嗰啲咁嘅嚴重外傷，或者跌親啦嚇。咁啊嚴重感染啦，譬如以前前嗰2-3年3-4年係有呢個新冠肺炎嘅，有啲人係病得好重噶嘛。咁呢啲咁嘅病症咧，如果你係遲咗去得到醫療嘅幫忙咧，個情況咧可能惡化得好快嘅。尤其是中風同心臟病嗰啲咧，真係同時間喺度競賽嘅。咁咧佢就話，即係當然係當你知道咗呢啲情況係緊急嘅時候咧，你如果係即刻去得到一啲醫療幫助咧，就可以幫到你嘅情況啦，幫到你嘅家人嘅情況啦。咁但係就係話呢四種咁嘅情況咧，只係大概嘅情況嘅啫。咁咧就並唔係話有其他嘅情況咧，都唔係嘅。咁所以咧，你都係如果你認為你覺得係哇都驚嘅喎，去打911，咁你就去打911啦。咁因為個個人嘅情形都唔同嘅，你有啲人譬如你就算打電話俾醫生啦，咁佢嗰個診所又閂咗門嘅，嗰個聽電話嗰個接線生啦， 就話哦，我去揾醫生啦，咁但係可能好耐都揾唔到噶嘛，咁所以你都唔好即係，如果你覺得個情況嚴重咧，都唔好等，都係可以打911去急症室嘅。
Just an additional slide to remind people that older adults have special needs. They may not be able to share like what their symptoms are or be specific, especially if they have dementia or other medical conditions. And they may need emergency care even for more minor symptoms or more minor injuries. So, we all saw in COVID that many people got infected, but most of the people that needed hospitalization or died were older people because they may be exposed to the same infection, but they may have a much more complicated course. And as another example, if a young person falls down, they may not get severely injured, but an older person, when they fall down, they could break a hip or they can have a significant head injury. So consider the patient and consider that the older adults to have like more risk for like severe injuries. I also want to note that the UCSF Parnassus ED is the adult ED. Mission Bay is a pediatric ER, and Children's Hospital Oakland is a pediatric ER. So if you're an adult seeking emergency care, just a reminder that it's the UCSF Parnassus Emergency Department. We're an age-friendly ED, so that means we have specially trained staff that are dedicated to evaluate and support older adults that are generally available during the day, but they also do education for the rest of our staff.
咁呢關醫生咧就係話，我哋雖然個情況可能相同咧，但係對老人家咧要特別小心嘅。點解咧？因為有啲老人家佢可能有啲智障啊咁啦，係咪？或者有呢個 Alzheimer 啊咁。咁如果佢有呢啲老人病嘅時候咧，佢可能講嘢或者表達自己咧係冇咁好嘅。佢可能係有一啲症狀咧，可能講唔到俾你聽嘅。咁所以你咧留意下佢哋。如果你覺得嗰啲就算有啲症狀比較輕微啲咧，如果你係喺安全方面咧，都可能帶佢哋去急症護理咧比較好啲。咁咧喺譬如喺呢個同埋一個情況啦，就係呢個譬如新冠肺炎咁啦。因為當一個年青人有咗新冠肺炎嘅時候咧，佢嘅情況同一個老人家得到新冠肺炎咧，真係兩回事咯。個老人家可以病得好重嘅 ，OK， 甚至可以致命嘅。其實我哋真係三藩市好多嘅老人家咧，得到新冠肺炎咧，都過唔到個關嘅。咁但係你如果係後生嗰啲咧，佢冇事嘅喎，佢得到好似有個傷風咁樣，咁佢就好返，咁就冇事噶啦咁。所以咧，就算同一個情況啊，得到感染，但係喺個老人家嘅處理方面，同一個後生仔嘅處理方面咧，係我哋都係會唔同咯。所以你如果係穩陣起見，就係穩陣起見呢4個字，咁你都係同佢去急診室，但係即係有時好多時咧都係打個電話去先，咁然後等佢哋知道你係嚟咯，係咪？咁咧就係UCSF 啦，我哋講翻自己加州大學呢個醫療中心啦。咁咧呢個三藩市嘅醫療中心咧就係有不同嘅地方嘅。咁喺 Parnassus 嗰度咧，即係喺新西嗰頭嗰度啦。咁嗰個醫療中心咧就係最舊嗰個啦。嗰個先至有個成人嘅急診急診室嘅。至於係新嗰個咧，喺 Mission Bay 米神灣嗰個咧，嗰個淨係得個小童嘅兒科嘅急診室嘅啫。同埋喺對面海，即係喺屋崙嗰度嗰一間嘅兒童醫院咧，都係淨係得個兒童嘅急診室嘅啫。所以如果係各位如果係有係成年人要用急診室服務咧，就唔好兜路啦，就叫嗰個救傷車，或者係如果家人同你車去嘅咧，你就去咗Parnassus， 即係朱台街一路連住過去嗰條街就變咗名做 Parnassus 噶啦。咁咧就喺去嗰個醫療中心就好啦，嗰個急診室。
We have lists mainly because this slide deck will exist online, but I don't think it's super high yield to spend too much time on this. We want to save some time to go through the rest of the slide deck and questions and answers. So generally this list refers to new or different symptoms, severe and persistent symptoms. So naturally, if you're having trouble breathing, if you're having chest pain, especially if it's when you're going upstairs or exerting yourself, upper abdominal pain or chest pressure lasting 2 minutes or more, something that's like not just a moment, fainting, sudden dizziness, being too dizzy to walk, or weakness in arms or legs, changes in your vision, choking, significant trauma, including head injury, especially for older people, and any ingestion of poisonous substance. These are all among the things that you may need to seek emergency care for.
咁呢一個嘅表咧，就寫咗不同嘅緊急症狀咧，但係呢個表啊係列唔晒所有嘅緊急症狀嘅，所以大家睇呢度咧就知道一啲大概嘅最常見嘅緊急症狀，但係並唔等於如果唔喺呢個表裏邊咧就唔係緊急症狀嘅。OK， 咁咧最主要我哋都知道啦，個心同埋個肺非常之重要啦。如果我哋無端端有一啲症狀咧係以前冇嘅，而家突然間係會發生嘅，咁你都要特別留意啦，因為呢個係變咗一個特殊嘅情況，點解會有咧？咁係可能喺醫療嗰方面咧，我哋係要快啲去揾出個原因而去治療嗰個情況嘅。咁譬如呼吸困難啦，突然間好難呼吸嘅，或者氣喘喘啦，咁或者係個心嗰度係會有啲壓力啊，或者個心啊扯住痛啊咁樣，咁咧有時都未必係個心嘅，可能上咗個膊頭，或者甚至好似牙腮痛咁嘅。咁你如果係呢啲咁嘅情況咧，如果你又唔係有爛牙，又唔係話有啲咩情況令到你知道係點解會有呢啲咁嘅症狀嘅咧？咁你就如果個症狀係維持咗2-3分鐘都仲係喺度嘅咧，咁你可能都係要去打911噶啦。咁啊，至於係等個仔或者等個女放工翻嚟先車你去醫院啦，又或係打911咧，呢個真係要可能係人命有關嘅，因為如果你因為有好多朋友咧，我哋知道咧佢唔想啲急救車啊，V 聲咁樣嚟到個屋企嗰度，驚住俾隔離鄰舍睇到，唔係幾想啊，right？咁咧，於是咧就話不如我等一等啦咁。但係如果有一啲情況危急嘅嘢咧，你唔好等啊，因為等咧可能會致命噶。OK？ 但譬如突然間暈啊，突然間一邊身冇力啊，或者睇嘢有變化咁，突然間覺得好模糊啊，或者最主要係一邊嘅症狀咧，呢個同中風有關係嘛？或者窒息，即係好似直情跑唔到氣咁，或者跌親啦，細路仔跌親就冇咩事喎，年輕人跌親冇咩事，但係老年人跌親咧，你都唔知係裏邊有啲咩問題噶嘛，即係老年人啲骨又脆啲啦，即係可能個頭嗰度撞親咧又傷啦，咁嗰啲都係好嚴重嘅情形嚟嘅，或者係食嘢中毒啦。食嘢中毒咁啊，又屙又嘔嗰種啦，係嘛？咁呢啲所有嘅情況咧，都係如果有咁嘅情況發生咧，都係去急症室就比較安全嘅。
Some additional symptoms, just like Diana was saying, if you're having trouble talking, one side of your face is drooping, or you have weakness on one side of your body, that could be a stroke. Confusion or changes in your mental status, so unusual behavior or difficulty walking. Any sudden or severe pain that's persistent, uncontrolled bleeding, severe or persistent vomiting or diarrhea, or both, that can cause you to be significantly dehydrated, coughing or vomiting blood, suicidal or homicidal feelings are other reasons to seek emergency care.
咁呢個表咧就繼續係講多啲一啲情況係要去呢個急症室嘅情況啦。咁有一樣嘢我哋係非常非常之關注嘅咧，就係喺亞裔之中啊，好多人有血壓高啊、糖尿病啊嗰啲咁嘅，咁咧中風嘅機會咧係多過多嘅。咁於是咧如果係但係中風咧好多時嘅症狀咧就一邊身嘅，即係一係咧就講嘢咧聲，突然間言語不清啊，或者你同佢講嘢佢都唔知你講乜啊，你又唔知佢講乜啦咁啦。個面咧又一邊跌咗落嚟啦，你叫佢笑咧兩邊你睇到佢嗰啲肌肉咧係唔平衡嘅，咁啊或者一邊身體冇力啦，即係手軟腳軟咁樣，你叫佢攞起隻手佢都攞唔起嘅嚇。行路又係跌下咁啦，因為一隻腳冇力啊嘛。咁或者佢個人變得好混淆啦，即係平時都冇咁懵嘅，突然間你講嘢佢都唔明你講乜嘅，咁啊或者係突然間瞓着咗喎，咁你叫 叫佢醒都好難叫得醒嘅。咁或者佢突然間好痛啦，邊個部位突然間好痛啦 ？OK， 出血啦，出血多數人都會識去急症室噶啦，因為見到啲血都驚噶嘛。咁咧但係屙啊嘔啊幾時先去咧咁？咁你通常一開始嘅時候你唔會去嘅，但係如果一連幾個鐘頭都係咁又屙又嘔咧，咁可能脫水啊，或者又脫咗一啲礦物質啊，咁可能好嚴重噶喎。咁所以咧都係去一去。如果你嘅醫生睇唔到嘅醫生去話俾你聽點做嘅咧，就係去急症室啦。咁或者係咳啦，咳得好犀利啊，或者咳到吐血咁樣樣啦。咁有一樣嘢咧，就係呢個自殺同埋呢個殺人嘅感受。如果你覺得突然間你好似失控咁嘅情緒，想一係咧就會去殺人，一係咧就想殺死自己咁。呢啲咁嘅情況咧，你要知道呢個係一個不正常嘅病態嚟嘅。咁就真係去一去急症室，等嗰啲醫生俾啲藥你，等你個情緒可以安定翻嚟。咁呢啲都係可以去急症室嘅情況嘅其中嘅一部分。
So some considerations for kids. Children are still growing, and so their medical issues may be different from adults. Like some older people, they may not be able to report their symptoms or describe their symptoms. So we have to take special care in monitoring them. And they may display different signs or symptoms from adults when they're injured or sick. And treatments may differ. Any emergency department can see people of any age, but pediatric emergency departments are specially staffed 24/7 for people who are dedicated to seeing pediatrics, and the hospital is built around the special needs of children. Though I would also have to say, like, the environment is more conducive to having small children there compared to an adult emergency department, and the wait times are usually less. The two pediatric emergency departments at UCSF are at Mission Bay and at Oakland Benioff Children's Hospital.
Are we the only two places with emergency departments specialized in pediatric medicine? Are there other hospitals in the San Francisco Bay Area with that service?
Maria, I'm not sure. I'm not the most up to date. I think Stanford has a children's hospital.
Well, Stanford has a children's hospital and a children's emergency department, but in San Francisco, in the San Francisco Bay Area, it's really just Oakland Children's and Mission Bay.
And CPMC had a pediatric emergency department in Laurel Heights, but I think it's rolled into the ER at CPMC.
So do they still have it, or they don't?
CPMC's it's not as separate. It's not like a separate emergency department.
咁咧就係呢個，如果係細路仔，年紀細嗰啲細路仔，尤其是咁，如果佢係一個緊急嘅情況，需要去急症室㗎啦。咁咧第一樣嘢咧，我哋要知道咧，就係佢哋受傷或者係病嘅時候咧，佢哋出現嗰啲症狀，可能同成年人咧係有啲唔同嘅，所以治療亦都有啲唔同嘅。所以最好咧就係去一啲有特別嘅為兒童而設嘅急症室咧，佢哋咧係會有多一啲安排咧，係等嗰啲兒童覺得舒服啲啦，冇咁驚啦咁。咁咧我哋咧就UCSF 咧就有兩個兒童嘅急症室嘅，一個咧就喺屋崙嗰邊啦，就係個屋崙嘅兒童醫院啦。咁另外一個咧就喺我哋新嗰啲醫院，喺米神灣嗰啲新醫院嗰度，亦都有一個兒童嘅醫院，裏邊亦都有一個兒童嘅急症室嘅。咁所以大家咧就唔好去錯啦。細路仔咧，如果你住喺三藩市咧，細路仔咧就去米神灣嗰度就係有急症室。大人咧就要嚟 Parnassus 嗰度有急症室。OK， 咁咧呢啲急症室嘅裏邊嘅人咧係特別受過訓練去同兒童做急症嘅工作。佢哋亦都係一個禮拜7日24小時係會有人喺度嚟到幫助呢啲兒童嘅。
So symptoms to look out for in kids: severe headache or vomiting, especially following a head injury, uncontrolled bleeding, inability to stand or unsteady walking, confusion, unconsciousness, being unresponsive, abnormal or difficulty breathing, skin or lips that look blue or purple or gray, feeding or eating difficulties, increasing or severe or persistent pain.
咁一列咧就係嗰啲兒童嘅急症症狀啦，都係其實就係佢一有變同平時個樣唔同嘅，你就要特別留意啦。 咁佢可能係有啲好嚴重嘅頭痛啊，或者係嘔吐啊咁啦。尤其是佢如果係跌親啊，跌親落地下咁，突然間嘔，噴到啲嘢去對面房對面嗰張床嗰個牆嘅咁咧，依啲咁嘅嘔吐情況咧係非常之嚴重嘅。咁啊，當然係譬如切親手啊，或者跌親出血嗰啲啦，或者佢原本係識行噶啦，但係佢都企唔到起身，但係行幾步咧跌翻低，或者係冇咗知覺啊，或者係呼吸有困難，或者係即係你覺得佢係呼吸快咗好多啊咁嘅情況啦。咁啊，另外一樣嘢咧就係好顯明咧，就係佢睇佢個口唇啊，大人細路都係咁噶啦。你如果係睇佢口唇，佢變藍色啊、紫色啊或者灰色，即係冇血氣嗰種嘅口唇咧，呢個係一個非常之嚴重嘅情況嚟嘅。咁咧就細路仔有時亦都未必識講嘢嘅，但係你覺得咧你想餵佢食嘢咧，佢又唔肯食啊，即係食咗又嘔翻出嚟嗰啲咁嘅情況咧，都係嚴重嘅情況嚟嘅。咁如果佢係覺得好痛啊，佢識成日喊，佢或者未必識講，但係佢成日喊嘅，你掂一掂佢，佢又成個人跳，或者喊得大聲啲嘅。咁呢啲咁嘅情況咧，你都係要特別留意嘅。
Other symptoms, fever, especially if it's accompanied by a change in behavior. Any significant change from normal behavior, which could be confusion, delirium, which is like sometimes they're very active, sometimes they're like less responsive or very sleepy, irritability, seizures, which could be a full body shaking or repetitive like muscle twitching, strange or withdrawn behavior, or being really lethargic. So really not really responsive, not taking an interest in their, favorite toys, like looking listless and having no energy.
咁繼續咧，又講多一啲緊急嘅細路仔嘅病狀啦。咁咧呢啲咧都係可能係需要去急症室嗰度睇一睇嘅。或者發燒啦，發得好高燒啦，係咪？咁或者佢細路仔成個人變咗，突然間變得好扎扎跳啊，或者係好靜啊咁，即係任何一啲精神上嘅行為上嘅變化咧，你都係要小心佢嘅。咁咧就或者個人咧就好似混混亂亂啊，或者係癲癲地啊咁，或者係反應嘅能力咧又低咗啊咁，或者咧就成日想烏眉瞌睡啊，叫佢醒都好難嘅，或者個人好煩躁啦，即係好容易發矇疹啊，啲咁多嘢喊啊，或者有抽筋啊，嗰啲肌肉會你睇到佢抽筋嘅，咁咧總之佢行為上有咩奇怪嘅行為啊，或者一啲孤僻嘅行為係同呢個細路仔平時嘅行為有分別嘅咧，你就要特別留意啦，因為佢唔識話俾你聽佢自己有咩病嘅，咁就係要大人咧就睇到呢啲咁嘅情況咧，就帶個細路仔去如果個醫生未閂門嘅，可以去診所啦。但係如果係個醫生閂咗門嘅，咁你可能要帶佢去急症室，唔好等到個醫生開門啦。
So another option is to go to urgent care when you maybe aren't able to see your primary doctor. It's something that can't wait, but you may not have a life-threatening illness, and you may not want to go to the emergency department. But just be aware that when you go to urgent care, if they feel like you may have something more serious, they will see you, but then send you to the emergency department. So the copay may be less with your insurance to go to an urgent care, but then you may end up with 2 copays because they send you to ER. The other thing is that the emergency department, everybody can be seen in the emergency department. That's like, we are required to see everybody that comes to us. So it doesn't matter if you have insurance or not. Urgent cares may, they don't have that same mandate. So some of the things that you might seek urgent care for are more minor, but things that may need immediate help, like persistent cough. You might need, prescription for an inhaler, or get evaluated for a minor pneumonia, bites, cuts, diarrhea, ear pain, fever or infections, mild asthma, so not severe shortness of breath, minor burns, nosebleeds, rashes, painful urination, vomiting, sore throat, simple fractures, sprains or strains. So it's hard to completely delineate when you're perfectly fine going to urgent care and when you're going to the ER. All of these things, of course, we can take care of in the ER as well.
咁咧有一個 另外一種新嘅醫療嘅方法咧，就係呢幾年啦，最近呢幾年咧開始有嘅，就係呢個緊急嘅護理，叫做 urgent care。咁各位可能都見到有不同嘅地方咧，都有一啲譬如 Go Health 啊嗰啲咁嘅 urgent care clinic 嚇，係一啲緊急嘅診所，但係又唔係急症喎。佢同急症有啲分別，急症咧可以係生死攸關嗰種，呢個咧就係佢又唔係話生死攸關，但係都係有啲緊急嘅原因嘅。譬如咳得好犀利啊，或者切傷咗，咁你都唔想去等3日，要等2-3日。如果你啱星期5夜晚黑整親嘅，你都唔想等到星期1先去搞噶嘛。咁你都係要去揾個醫生嚟到同你或者睇下止咗血啦，諸如此類。即係有啲咁嘅情形咧，你咧就可能咧就唔需要去呢個急症室，因為唔係生死攸關啊嘛。但係咧你就可能要有啲急診嘅服務咧，都係喺個醫生普通嘅醫生閂咗門嘅時候咧，係可以去嘅。呢啲咁嘅緊急服務咧，通常咧就係會開夜啲啦，可能開到8-9點啦，或者係星期六、星期日或者都會開啦，就唔係星期日都可能星期六會開啦咁。咁咧就係即係補呢個醫生閂咗門嗰個普通嘅醫生嗰個診所閂咗門嘅不足。本來個醫生係可以同你搞嘅，但係因為佢閂咗門，但係你又唔係急症啊，咁於是你咪去呢種咁嘅中間呢種咁嘅服務嗰度咯。但係咧記住喎，呢個服務咧係你如果係冇院所咧，可能有啲麻煩嘅，因為咧如果你去急症室咧，急症室嗰度咧就係話你冇錢，我哋都要去醫一醫你，等最低限度要睇一睇你係冇生命危險嘅 ，OK？ 咁然後先話俾你聽點樣做。但係呢種咁嘅urgent care 嘅緊急護理咧，佢係冇呢樣嘢嘅，佢可能係即係要你交啲錢，然後佢先同你睇症嘅。如果你冇醫療嘅話，即係冇醫療保健嘅話，咁所以咧大家咧就喺呢方面咧要小心啲啦。咁當然係即係個情況幾時先至去呢啲 urgent care， 幾時先至去呢個 emergency 個 department 嗰度咧？咁呢個始終都係你要自己做一做決定，係咪？但係咧，雖然話係肚屙啊、耳痛啊咁樣，就呢啲症狀啊，要睇個嚴重程度啦。譬如你係燒傷 ，OK？ 咁你燒傷幾多咧？如果你燒傷成身一半以上都燒傷嘅，咁當然呢個好嚴重啦，咁啊梗係要急症室啦。但係你譬如你燒傷係攞啲熱水淥一淥隻手指嘅。但係好痛喎，起咗個泡喎，你唔知點搞喎，咁你又唔想等到個醫生開門先咩？咁你咪可能要去呢啲urgent care 嗰度去俾人睇一睇咯，係咪啊？或者係嘔，咁你嘔幾多咧？嘔得密密咧？幾嚴重咧？咁即係每一樣嘢咧都有佢嘅嚴重嘅程度嘅，所以呢樣嘢咧就會等你自己要做一做決定，係去呢個 urgent care 嘅呢個服務夠唔夠咧？如果係去到嘅時候，真係個情況比較理想之中嚴重嘅咧，呢度都可能會由嗰度再轉介你去急症室嘅，所以咧你可能係即係兩頭都要去咯。所以呢個係大家即係要個心裏邊知道呢個急診服務同埋呢個急症室咧，就係有咁嘅分別嘅。咁呢啲症狀大家都睇過啦嚇，即係就係要大家都知道不同嘅症狀咧。都可能會令到你擔心，你咪同佢，如果個普通醫生嗰個診所閂咗門嘅，你咪同佢急症室呢個緊急服務睇一睇咯。
So I was going to talk a little bit about what you can expect when you go to the emergency department. So the first important thing is that you can never be turned away from any emergency department, even if you cannot pay. And that is a federal law. So by law, we are required to see every single person who comes through our doors and give them a medical screening exam and make sure that they get the care that they need. Also important for you to know that phone and video interpreter services can be provided 24/7 throughout your emergency department visit. We always have access to interpreter iPads and a mechanism for having interpreters on our phones. One thing is we cannot control how many patients come to the emergency department at a time. So sometimes we'll get a lot of patients coming at once and we have to kind of triage all of them and figure out who's the sickest, et cetera. So that is one thing, because we can't turn anybody away ever, and we don't want to, that is a little bit unpredictable about how the day is going to go and how crowded it will be.
咁咧呢個咧就係 正話已經提過啦，就係當你去到呢個急症室啊，醫院裏邊嘅急症室嘅時候咧，醫院嘅急症室咧係唔可以就咁趕你走嘅，你有錢冇錢都唔可以嘅，佢一定要睇你，一定要知道你真係冇生命危險啦，先至可以話俾你聽要點樣做，係咪啊？咁咧，但係因為有咁嘅情形咧，於是咪可能有好多人去咯，有一啲人係即係好少嘅嘢去到，所以咧佢哋咧就係好難去估計啊，有幾多人會喺急症室嗰度嘅。咁但係你自己要心理有準備咯。你如果去急症室咧，係如果你個如果係少嘅嘢咧，你可能要等一輪噶咯。而且等嘅時候咧，並唔係話你先到先睇你，唔係咁嘅，係邊個嚴重就睇邊個先嘅。咁咧，另外一樣嘢咧，要提一提大家嘅咧，就係我哋點解要做呢樣嘢用中文講咧？因為有一啲朋友咧對英文咧就可能識啲，但係咧又即係唔係講得好流利，咁就好驚嘅。去到即係好似我哋嗰啲醫院咁咧，驚住冇人去唔識溝通啊，冇人識講中文啊。呢個大家唔使擔心嘅，因為我哋而家咧，尤其是急症室啦，其實全個醫院都係咁嘅。如果你係需要同醫生溝通，而我哋嗰個醫生係唔講中文嘅咧，係一定我哋係有一啲翻譯員啊、口譯員啊，同你做呢個翻譯，等你可以同個醫生係暢通咁樣去溝通嘅。所以大家千祈唔好為咗呢個溝通嘅問題咧而窒住隻腳就唔去醫院，呢個唔會發生嘅。去到醫院裏邊就會有人同你做翻譯噶啦。OK。
So in terms of arrival, when you first get to the emergency department, we have specially trained triage nurses, and they will determine how serious your condition is, your symptoms are, based on things that they are trained to assess. And it's very routine. We do this for every single patient. It's your vital signs, things like your heart rate, your blood pressure, your oxygen level, the symptoms that you're complaining of, and then also your medical history. And we do our best to accommodate patients who need immediate care right away because we want to get to the sick people that really need us emergently. And so part of this process is identifying these patients and kind of categorizing people as very, very sick or maybe sick, but you can wait a little bit longer and it could be safe for you to go ahead and do that. Also, just of note, ambulances arrive in a different area than people walk into our waiting room. So if you walk into the waiting room, we also, through a different door, have ambulance traffic coming in. And so you just may not be aware of that and the fact that we have other sick patients arriving at the same time who might need to get back to the main emergency department.
咁咧，大家咧要知道咧，呢樣嘢就係我哋好多病人咧係好猛，因為佢哋唔明白點解我嚟咗咁耐，點解佢又遲咗嚟，又睇咗佢先啊咁樣樣。你其實係可能應該慶幸嘅，因為咧即係證明咧你嘅情況咧唔係咁嚴重，而遲嚟嗰個人嘅情況比較嚴重啲，所以睇咗佢先，就係咁嘅意思嘅啫。因為我哋好多時咧人手嘅係有限噶嘛，咁你如果係個個排隊咁，如果有10個人喺度排隊，第11個人入到嚟，佢係非常之嚴重，係出緊血啊或者咩咁樣，要即刻止血嘅，咁樣樣咪要即刻同佢睇咗先咯，你明嘛？所以唔係話你早去就睇你先嘅，千祈唔好以為人哋係怠慢咗你，呢個唔係嘅。而且仲有一樣嘢喎，我哋咧每一個急症室咧都有2道門嘅，嗰2道門咩咧？如果你用自己行入去啊，就行一道門，另外一道門咧就係俾嗰啲救傷車。嗰啲人哋打911啊，救生車去車佢嚟嗰種咧，嗰啲咧要去泊車嗰個位嗰度又有一個門嘅，所以你咧未必係睇到底真係有幾多個病人嘅，因為嗰啲叫救傷車嗰啲病人咧，佢一嚟到咧，佢就同咗佢入房噶啦，咁所以咧唔會喺出邊嗰度坐喺度等俾你睇到嘅，所以就係希望大家咧知道咗呢啲咁嘅情況咧，你哋唔好心急，唔好嬲。你如果真係唔舒服，再唔舒服，你等得太耐啦，你可以同嗰啲櫃台面嗰啲人講一講。但係咧，呢個係佢哋，尤其是人多嘅時候咧，急症室我哋有啲高峰期嘅，即係多到咧嗰啲人咧要冷巷都排埋隊嘅。咁所以咧係大家希望有個心理準備咯。去急症室咧係可能要等好多個鐘頭嘅。 咁咧嗰啲裏邊咧亦都有一啲特別訓練過，識去睇邊啲病人嚴重啲，邊啲病人冇咁嚴重嗰種咁嘅，多數都係個護士嚟嘅。咁佢就會同你 check 下你嗰啲血壓啊、心跳啊、體温啊諸如此類啦。咁啊，然後咧睇下你有咩症狀啊，同埋你嘅病歷啊，有啲咩特別嘅病歷啊，係將總共嘅嘢擺埋一齊，然後嚟決定你個嚴重嘅情況嘅。咁就係由咁樣去排隊，所以排隊係個先後咧，並唔係你到嗰個急症室嘅時間嘅先後。
So we've gone over this a little bit, but when you do arrive, people that arrive after you get there may be seen before you, and this is because they may be sicker. On the other hand, they might have simpler needs that can be taken care of from a separate low acuity area that we have, or even from the waiting room. So the people that we tend to take care of quickly are the people that are very, very sick. And then there are some low acuity patients that we can kind of get in and out quickly. So if you see people going and getting back to the emergency department or being seen by a provider before you, even though you got there before they did, it's not because we're not aware that you're there or we don't care. We're trying to do triage, which is part of our job. So to kind of organize the patients in the most effective way so that we can really get to everybody, including you. And it's also important to know that we do have a nurse up by triage. We have doctors and other providers coming in and out. So if your symptoms or your condition changes while you're waiting, after you've already been triaged, you can let the staff know and someone can reassess you. Another thing to note is that well, actually, we'll stop there and then we'll wait for the next slide.
Great, thank you. 咁咧就係正話已經講咗一橛噶啦，嗰橛咧就係話即係你去到急症室嗰度咧，即係等咧就整到你成個人懵晒噶嘛。咁咧等咧就係可能有啲嚴重嘅病人就入咗嚟先，就我哋就照顧咗佢先啦。相反嚟講咧，喺急症室裏邊咧有一個地方啊，係專係為嗰啲好小事嗰啲人，將佢快啲睇咗，等佢快啲走咗，就冇咁多人喺個急症室嗰度逼埋一齊嘅。咁於是咧，可能有啲病人咧就係比你嚴重喎，但係可能有啲病人咧佢就根本可能都唔應該去急症室嘅。咁我哋就快啲睇咗佢，等佢翻屋企先啦。咁咧即係可能兩邊嘅情況都有嘅。咁甚至你自己咧喺個急症室裏邊等嘅時候啊，你個情況都可能發生變化噶嘛。如果你突然間覺得特別唔舒服啊，比以前初入嚟嘅嗰陣時仲差，因為而家我已經係等咗2個鐘頭啦，就係個情況又變差咁。請你即刻話俾嗰啲醫護人員聽啦，等佢哋再同你去檢查一下，睇下係咪應該即刻去睇你先咯。
Then in terms of your examination and treatment, once you do see a provider, it can go in phases. So an emergency physician or an advanced practice provider, like a nurse practitioner or physician's assistant, will examine you, and they may order tests like x-rays, blood work, like EKG to look at your heart, or other kinds of imaging like CAT scans. This might start at the triage area while you're waiting, because one of the things we do is we begin to triage people in order to kind of be efficient and help move people through and let them know that they are being seen, is we will start to send some initial tests based on what we learn about you at triage. Your vital signs will be monitored, and then nurses and other medical staff will provide additional care. And it's also just important to note that you may be asked to repeat your story multiple times during your time in the emergency department for a couple reasons. One is we are a teaching hospital, so we will have residents or medical students that might be the first person to see you, and then an attending physician like Dr. Kwan or myself will come over, and we might want to verify what we heard from the resident or the medical student. And then also there's a nurse, there's a doctor, there are lots of people on the team. And so it is true that everyone sort of likes to make sure that they're getting accurate information from you.
That is so difficult for some of our patients, having to repeat the story so many times, right? So, but it's important. So, 各位就係呢個咧，當你入咗急症室嘅時候咧，有不同嘅人喺裏邊做嘢嘅。咁咧，譬如你入嚟係跌親嘅咧，咁可能咧有啲醫護人員啊，或者係有啲幫醫生嗰啲人咧， 佢哋可能同你帶咗你去照下 X 光啊，或者同你抽啲血驗下，或者同你做，如果你話心口痛，可能同你做嗰個心電圖先啦。咁呢啲嘢咧，可能喺你喺個等候嗰個等候室嗰度咧，就已經帶咗你去做噶啦。咁但係你都未入房噶喎，係咪？咁咧，所以咧，呢啲咁嘅情形咧，係可能會發生嘅，就係可能係你等嗰個地方嘅等個醫生嚟嘅地方已經有嘅。而且我哋依間咧，即係我哋講 UCSF 啦，就唔係話講其他醫院啦。UCSF 咧係一間醫學大學噶嘛，我哋有。咁咧，醫學大學咪有得學生咯，有學生咁佢哋都要學嘢噶，佢哋唔係即係讀完書就會識睇症噶啦嘛，咁佢都要去實習噶嘛，係咪？咁咧個實驗室咧係一個佢哋非常好嘅實習地方啦。咁所以咧，可能你去到嘅時候咧，就由呢班醫學生咧就首先攞咗你啲資料，問你嘅詳情，發生咩事啊？你有啲咩症狀啊？有乜乜乜啊？咁以前嘅病歷係點樣樣？即係問咗你一堆嘢先。咁然後咧，你俾佢問完之後咧，可能咧跟住嚟嗰個主診醫生咧又會再問你話點解咁咧？點解我哋會重複咁樣做咧？因為啲學生咧喺一個學習嘅過程之中咧，佢問你寫低咗啲嘢啦。咁個主診醫生入嚟嘅時候咧，佢都要知道嗰啲嘢。再問清楚啲，可能有呢個咁嘅情況，就因為唔想出錯，係咪？因為每個人都要對你負責啊嘛，所以咧，呢樣嘢咧係可能會令到啲朋友咧係覺得話，咦，點解問完又問嘅？佢哋知唔知佢做緊咩嘢咁？其實我哋知嘅，我哋特登問多一次就係 make sure 係即係真正去確認嗰啲資料係正確，所以大家希望能夠原諒呢啲咁嘅情形。
Okay, and we do have a couple more slides to get through, so I'll try to hurry through these to make sure that we have enough time. So more about examination and treatment. So treatment like IV fluids or medications can be provided in the emergency department. And then, as I mentioned before, we can also do additional testing like advanced imaging. So that would be a CAT scan, an MRI, depending on what is needed. And also we can consult with lots of different specialists. And that can be necessary when in the emergency department too. So you can imagine how the time can add up while we're waiting for all these things to happen while you're there.
咁呢個咧就係當你入到去，如果嗰啲醫生或者醫務人員覺得你係有啲咩症狀，係需要食啲藥啊，或者係吊啲鹽水啊，或者係要做一啲特別嘅檢查啊咁樣樣咧，佢哋就會同你做嘅。即係呢個造影嗰個咧，就係譬如係做呢個 CT 嗰個叫做嗰啲電腦掃描咧，佢係可以同你去做嘅，就帶咗你去做完先。咁翻嚟嘅時候咧，嗰啲醫生有個影像咧，就知道你個情況到底係咩嘢噶啦。咁所以咧，呢個係會幫助佢哋嘅診斷啦。咁而佢哋咧，如果覺得有需要咧，譬如佢發覺你，咦，可能係中風喎，睇到好難中風喎，咁就佢又即刻去叫嗰啲中風嗰啲腦科嘅專家咧嚟同你去做中風點樣可以繼續將佢防止嗰個惡化嘅情況。我哋係有啲嘢可以做嘅，有啲藥可以俾，或者帶你去要即刻做手術啊咁。咁呢啲專家咧就會即刻嚟到呢個急症室嗰度咧就做呢啲咁嘅決定。所以諗下，如果你有一個嚴重嘅病人要做咁多呢啲嘢，佢喺前邊，你嘅前邊嗰度，咁你出邊嗰啲人咪要等耐啲咯，係咪？咁但係我哋唔知到底有咩病人嚟到嘅，所以都唔可以話俾各位聽係，大概要等幾多個鐘頭啊，咁係講唔到。
Your emergency department care team will discuss your diagnosis with you and your future treatment plan. So what any follow-up should be before you are discharged. And you might receive written instructions about medications, specialists that we want you to visit or follow up with, and then things that we would want you to come back to the emergency department for if things get worse, for example. One thing to note is that you might not always leave with a diagnosis, but you do need to understand that we will have tested you and considered all the possible emergency conditions and sort of made sure that none of those are happening. So that can be a bit confusing for people sometimes or frustrating, but in the emergency department, it's our job to really rule out the very, very dangerous things for you. But sometimes that means we don't have an exact diagnosis.
咁呢樣嘢咧就係大家可能都有經歷過嘅，就係去到急症室嗰度咧，佢叫咗你翻屋企啦，但係咧佢又冇話俾你聽話到底係咩情況咁樣樣，即係 大部分時間咧我哋都可以知道嘅，但係有時咧係需要再做多啲檢查，或者要再睇下等啲乜嘢嘅報告翻嚟先知嘅。咁咧，但係我哋急症室裏邊嗰啲醫生咧，第一樣嘢一定要做嘅咧，就係要將你一個緊急嘅情況咧穩定咗，冇生命危險，先至俾你翻屋企嘅。咁呢個你係大家應該知道係會做嘅。咁啊，至於決定你嘅診斷啊，或者將來要做啲咩嘅治療啊，要去睇咩醫生啊，或者食啲咩藥啊咁，佢可能會做一部分嘅，但係佢可能係唔可以全部做晒，因為嗰個時間有限。咁而且你當時咧個情況咧係唔係即刻可以同你做到呢啲咁嘅診斷，咁就叫你去睇一啲關於你嗰方面嘅專家，等佢再詳細啲做檢驗，再去查清楚一啲，再俾啲藥你試下，睇下可唔可以幫到你咁樣啦。但係就肯定知道咧，係我哋會將一啲最緊急嘅情況，等到你冇生命危險嘅情況，將佢控制住，然後先同你翻屋企。
Quick slide here. If you do have questions, you don't understand your instructions, or there's something that confuses you about the treatment plan, or you feel like you won't be able to do, please discuss this with your ED care team before you leave.
咁如果你有問題啊，你唔係幾清楚，佢講啲嘢我唔明白啊，諸如此類咁啦嚇，咁你咧就請你未離開之前咧，話俾我哋聽，我有啲問題我唔係幾清楚啊咁樣樣。咁記住我哋有翻譯員噶嘛，就算你用中文同我哋講都得嘅。OK， 咁你就即係搞清楚應該點樣做，然後先至好翻屋企。
Then, if you do require significant additional testing or care, or maybe you need surgery, maybe you need ongoing antibiotics for an infection, all different things, then you might be placed either in observation or you might be admitted to the hospital. Even once you're admitted to the hospital, you may wait for your room upstairs in the emergency department because the hospital is full upstairs and there aren't any beds available. So that can be confusing for people sometimes because we admit them to the hospital and to a new team that will be taking care of them now that they're admitted to the hospital. And it's not the ED team taking care of you anymore, but you're still in the emergency department waiting for your bed upstairs. So those providers will come, they'll come into the emergency department and see you, but it can be confusing for patients sometimes.
Yeah, that can be confusing. Yeah, so thank you for pointing that out, because some of the patients would wonder why all of a sudden there's a physician change or the team change. 各位，如果你係真係如果係要留院啊，咁我哋有啲情形咧，就係個醫院嗰度咧成日都唔夠位嘅。我哋要等個病人走咗啦，將嗰個房間清潔咗啦，然後先等你可以送你上房，係咪？咁你不同嘅科咧就去不同嘅部門，咁所以咧就有時咧真係會棘住晒嘅。咁棘住點咧？咁我喺嗰個急症室嗰度咧就有一個叫做觀察嘅部啊，叫做 observation unit。OK， 咁呢個觀察部嗰度咧就係等你等上房攞房嘅時候咧，就將你喺個急症室嗰度咧，就將你帶咗你去個觀察部嗰度。咁但係都係喺急症室裏邊嘅一部分嚟嘅喎，佢唔係話喺另外一一層樓嗰度嘅喎。咁你唔知嘅，你只係覺得佢同我由呢間房轉咗另外一間房嗰度，都係可能同埋一層樓咁樣。咁咧，但係突然間咧嚟睇你嗰啲人咧就完全唔同晒啦。咁同你喺急症室睇症嗰啲醫生咧，又冇再翻嚟咯喎，由另外一啲人嚟睇你咯。咁你覺得可能會覺得好混淆嘅。咁呢個就係咁嘅情況咧，即係當你要住院嘅時候，你要等房。如果你等到房上到去嘅時候，你都會有完全係唔同一班嘅醫生護士去照顧你噶啦。咁而只係咧，當嗰度冇訂嘅時候咧，你喺一個觀察嗰個地方嗰度嘅時候咧，都係有另外一班嘅醫生護士喺呢個觀察部嗰度嚟到照顧你，等你係一路係受到呢個醫療嘅服務嘅。咁所以大家如果見到啲人可能唔同咗，咁所以千祈唔好擔心。呢個只係個醫院裏邊嘅制度，要係咁樣，即係佢唔可以叫你喺個急症室嗰度等住間房，咁出邊嗰啲人咪更加耐，更加入唔到嚟睇咯，係咪啊？所以呢個係疏通病人嘅方法嚟。
And then we wanted to just give some information about a checklist, like if you know enough in advance that you're going to the emergency department, then you can do things in advance so that when you go, you'll be really prepared. So one of those things is storing emergency numbers on your phone, making sure every family member knows how to call 911, and to give his or her name, address, and a brief description of the emergency. Because sometimes an ambulance transporting someone will call ahead to us and let us know about the person coming in based on what the family has told them and what they're seeing in the patient. And that is good because then we can prepare a little bit in advance if someone's coming in that's quite sick.
咁呢個咧就係希望大家咧係做一個預備咯，尤其是年紀大嗰啲咧，咁你可能會有需要急症室呢啲服務咧，咁你就請你將急症室嘅電話你就留咗喺個手機嗰度，咁一撳咁你就知道哦，就係呢個電話，唔使去到時砰砰砰咁去揾。咁然後咧就你嗰啲家人即係同你近身嗰啲家人咧，就亦都應該知道係要打911啦，係咪咩情況要打911啦？咁同埋咧打911嘅時候要點咧？咁要俾你個名啦，俾你嘅地址啦，同埋發生咗咩事啦，咁即係要教佢哋講嘅。如果唔係咧，佢哋如果未打過911嘅時候咧，可能會好亂下嘅，所以你可能要同你嘅家人有做個溝通咯。咁你個手機咧係你嘅聯絡嘅非常之好嘅方法嚟嘅。
It's also important to organize your family's medical information. So complete medical history forms on every family member, and you can keep up-to-date copies in your home, your car, your wallet, your phone. Make sure you have ID and forms you need, like if you have an advance directive about your end-of-life wishes. That's really important for us to know in the emergency department so that we make sure that any of the interventions we do are things that you or your family member wants us to do. Also, seniors should consider keeping forms on their refrigerators because the ambulance staff knows to look there for any relevant medical forms. And these could even include past hospital records from prior hospital admissions.
咁咧就係又係要為呢啲咁嘅情況做準備啦。咁就希望你將你嗰啲醫療嘅病歷所有嗰啲譬如你有個事前嘅醫療嘅指示諸如此類嗰啲嘢啦，你嘅電話號碼地址諸如此類啦，就將佢擺好一個地方。咁如果你必要時去急症室嘅時候咧，一攞咁就可以全部攞晒啦。咁咧好多時咧，如果係叫救傷車嘅時候咧，佢哋都會喺你個雪櫃嗰個門嗰度咧睇下有冇嘢嘅，因為好多人都將嗰啲重要嘅嘢擺咗喺雪櫃個門嗰度咧，等嗰啲急救嘅人員咧可以一睇就知道喺嗰度攞嗰啲表病歷表諸如此類嘅。咁大家都可能可以買一個呢啲咁嘅嘢擺咗喺嗰個雪櫃門嗰度，咁就可以將啲病歷表嗰啲嘢擺咗入邊。咁如果必要時咧，嗰啲人嚟救你咧，都可以嗰度攞到一啲信息嘅。
Keep updated medical history forms that include information on medical conditions, allergies, medications, and then contact information for your doctors. And then you can also add in case of emergency entries to your cell phone address book. And if you arrive to the emergency department and you're not conscious or you're not well enough to speak, then emergency staff knows to contact your to look in your cell phone for this type of contact information.
咁呢樣嘢係非常之重要嘅，因為譬如我如果係需要打911要人嚟救我嘅時候，咁但係佢嚟到嘅時候我暈咗啦喎，咁佢通知邊個咧？咁你一打開個手機，咁個手機裏邊有好多電話號碼，好多名噶嘛，咁嗰啲人員點樣知道邊個先至係佢哋應該打嘅電話咧？咁咧而家咧就係教你哋用 ICE 呢三個字母打咗落去嗰個名嗰度。咁呢個 ICE 咧，可能係你嘅仔女可能係你嘅親人或者係你嘅先生或者太太諸如此類啦，好親嘅人咧，就係你想如果知道你有事要去醫院嘅時候咧，如果你自己唔識講嘅時候咧，佢哋可以由個手機嗰度一打 ICE 嗰3個字落去咧，就會打到個電話就會跳咗出嚟，咁咧就知道哦，呢個人就係我要去通知嘅人啦咁。所以咧你如果係就咁打個名咧，譬如你就咁打我個名打啦，咁人哋唔知我係邊個嚟噶嘛，係咪啊？咁所以咧就唔會 call 我嘅，就即係因為佢哋唔知道你同我嘅關係啊。咁但係咧，如果你打 ICE 咧， 而將我嘅電話打咗落去嘅時候咧，咁樣咧，嗰啲人咧就知道，哦，你係我嘅親人，咁咧就會打電話俾你，就係咁樣嘅。所以呢個係一個非常之好嘅方法嚟嘅，即係將啲嘢擺喺個雪櫃嘅頂嗰度，喺個手機嗰度留 ICE 嘅電話。OK， 咁你希望各位聽完今日嘅講座之後咧，就將你需要想邊個人受到通知嘅咧，就將佢個名寫咗做 ICE， 然後打咗落個手機嗰度，將佢電話入咗去。
One additional thing I forgot to mention is make sure that your house number, your address is visible from the street so that if EMS does need to come in an ambulance, they'll know where to go and they can easily recognize your address. Also, you can wear medical jewelry if you have a chronic medical condition or allergic reactions, just because that's another way that healthcare workers can access your medical information.
咁咧就有一樣嘢咧要提大家嘅咧，就係請你睇下你屋企個街門口嗰度啊，個街門嗰度有冇個 number 咧？因為其實好多人嗰啲屋啊，嗰個 number 咧係冇寫喺嗰啲牆啊或者啲門上邊嘅，咁所以咧如果叫嗰啲救傷車嚟嘅時候，你話幾多號咩街咁，佢咩街就去到啦，幾多號嘅時候咁就麻煩啦。佢真係要逐間屋咁去數咩？梗係唔係啦，係咪？咁所以咧，如果你嗰間屋咧係冇一個number 喺出邊嗰度係好容易俾人揾到嘅咧，呢個係一個問題嚟嘅。會阻礙咗呢個救傷嘅時間。咁咧，另外咧就係呢條咁嘅帶咧，就係一個好似手鏈咁樣樣咧，裏邊咧係將你嗰啲醫療嘅情況咧係喺呢條帶嗰度係裏邊係藏住咗嘅。咁你就可以買一條呢啲咁嘅帶，將嗰啲醫療記錄擺咗喺入邊嗰度。
You want to establish a plan for transportation also. In a life-threatening emergency, you want to call 911. You don't want to drive yourself. If you are able to drive, though, go to the closest emergency department. Don't delay care by going to more distant hospitals.
咁咧，如果係你要去急症室嘅時候咧，如果真係有生命危險嘅咧，你一定要打911，你唔好驚話嚟到唔好意思嘈住隔離鄰舍咁樣樣，呢個唔應該喺你嘅計算範圍之內嘅。有緊急嘅症狀，你就要打911。OK， 如果你真係可以覺得自己唔係咁嚴重，係可以自己揸車嘅咧，咁你都要去最近嗰間醫院咯。咁因為你最近嗰間醫院咧，就會同你慳咗啲時間，寧願去到嗰度睇下佢哋點講先，係咪？如果佢哋覺得你嘅生命情況係唔係好嚴重嘅，係可以轉翻去你自己原本間醫院，佢哋都會同你去嘅。咁所以你唔使驚嘅，但係方便起見咧，就去你最近嗰間醫院。OK， 救傷車好多時都係咁噶啦，都係車你去最近嗰間醫院嘅，尤其是你有生命危險嘅時候啊，係最近就係最快嗰間醫院。
And these are just some references that we have that you can use. Where some of the information from this talk came from so that you can have easy places to go to reference some of the information that we spoke about today.
咁咧，呢啲咧就係一啲參考嘅資料咧，就係講急症室點樣去適合咁樣利用急症室嘅服務嘅資料嚟嘅。咁咧你哋喺呢度咧就抄唔到嘅，你可以而家攞個手機出嚟咧去影張相。咁咧就有呢個資料啦，但係咧另外一個方法咧就係我都會將呢個資料咧就將喺下一次嘅電郵嗰度咧，我係會將佢擺上網嘅，即係擺上個電郵嗰度啊。咁如果各位收唔到個電郵嘅咧，咁你可以參加我哋嘅電郵嗰個網咯。咁我遲啲會話俾你聽點做噶啦，所以唔使擔心你而家係冇呢個寫唔切咁多資料吓。One of the questions that people may not ask is they still have to make certain judgments because whether calling 911 or whether they are safe to drive themselves or have a family member drive them, what are some of the advice that you can give them? Because this is the number one thing that will come up is like, do I call 911? Because there is a financial implication in that. Plus, a lot of the people I know don't really want to alert the neighbors that you are that sick that the ambulance has to come to rescue you and then get everybody all excited and curious.
I didn't realize till you mentioned it several times in this town hall that it was an issue that people were embarrassed to call 911. For sure, if you think you might have a life-threatening emergency, if you're having severe chest pain, if you're having signs of a stroke, then time is really important. You need to get to the emergency department. So for very time-sensitive issues like significant trauma, you think you might be having a stroke or a heart attack, it is worth coming in with the lights and sirens because we will be prepared to receive you if you're really sick. So I would encourage people to not worry about being embarrassed, not worrying about inconveniencing their family members. If you think you're having a life-threatening emergency, then you need to get care as soon as possible.
咁我正話問呢班醫生咧，就係話如果係即係我哋好多時都唔知道係叫救傷車好啊，抑或自己揸車去好，或者叫啲仔女等啲仔女揸車同我哋去急症室咁啊。咁所以呢樣嘢咧就係要大家都要係即係睇自己嘅情況。如果你覺得係真係一邊身都唔係幾妥，可能係中風啊，即係有個咁嘅可能咧，或者可能係心臟病發啊，或者可能係哇，即係可能跌得好傷嘅喎，可能即係裏邊嗰啲骨頭唔知點樣樣嘅喎，諸如此類咁咧。咁你如果有個咁嘅可能嘅懷疑嘅時候咧，就最好都係打911咯，即係唔好擔心點樣樣唔好意思啊，或者嘈住人半夜3更 V 哇哇嘈住隔離瞓覺啊，嘈醒晒成條街啊咁樣樣，即係唔好擔心，唔好話怕。呢個怕字咧喺我哋嘅華人社會之中咧，真係有時係好害事嘅。我哋就係怕呢樣怕嗰樣咧，就有啲嘢唔做咗，因為唔做咗咧就係變咗係自己受咗傷害嘅。
Somebody asked what's medical jewelry. Those are like the bracelets that will show your medical condition. So it might say that you have a severe allergy. It might say that you have, a heart condition or whatever. And that way, if you can't speak for yourself when you end up in the emergency department, we'll know about those kind of urgent issues.
And where can they get them?
That's a great question. I actually don't know where you get those, but Maria?
I actually don't know either.
I think that would be a good Google question, or you can ask your regular doctor. Another plug for primary care.
咁嗰啲手鐲咧，嗰啲醫療手鐲咧，可能係上面寫住話你曾經中過風啊，諸如此類，有啲咩嘅大事，或者你有心臟病咁咧，如果你係戴住咧，咁就嗰啲人咧一睇就知道，呢個人可能會中風啊，可能有心臟病再發作啦，咁諸如此類。咁咧，但係我話啲手鐲喺邊度買咧？咁大家可能上網啦，問一問啦，Where can I get a medical bracelet？ 揾人，如果你唔識英文嘅，揾人同你打上去，咁打出嚟，我好相信係上網可以買到咯。因為而家嗰啲賣醫療器材嗰啲鋪頭都好少見啦。我唔知道嗰啲藥方賣藥嘅地方啊，即係藥房咧係有冇，我就未見過。即係譬如 Walgreens 啊、CVS 嗰啲，我未見過。但係所以最好都係上網睇一睇咯。或者問一問你嗰個基礎醫療醫生啦，嗰個 primary care 嘅醫生啦，或者佢會知道嘅。不過都如果係可以自己上網揾到，都唔使等到去見到佢先問啦，係咪？ Sounds like that there's not much questions about this topic. I think that mainly is because people don't expect themselves to go to the emergency department. It's not something in our mind that we think about on a daily basis, right? So there's not much thinking about it. So that makes the talk even more important because now we got you thinking. Now you know that you have something to prepare for things that you don't want to happen, but if it does happen, then you are prepared. Being prepared is the name of the game, especially in an emergency, and it can mean life or death to you. So I hope that everybody learned something from this lecture and that you are able to get yourself ready, get your medical bracelet ready, get your phones ready, get your family and friends, whoever that you want to be contacted ready, and kind of, get your envelope on the refrigerator. So there are things that you need to do. This is not just a lecture that you come and listen to and then walk away. This is a lecture that you come to listen to and then make your list of to-dos and then go do them so that you can get yourself prepared. 咁希望大家今日聽完今日嘅講座之後咧，就自己去做啲嘢啦，唔好話聽完就行開咗，就好似以前嗰啲講座咁咧，就咩都唔做啦。因為呢個咁嘅講座咧，就係會將你帶到一個情況咧，就係當你真係要去急救室嘅時候咧，而有救傷車嚟你屋企嘅時候咧，你做嗰啲嘢啊， 係會幫到佢哋知道你當時咩情況，即係可能有時係可以救到你一命嘅。即係你如果係寫個有個嗰個病歷表嗰度寫過話你曾經有個中風咧，我哋係會好即刻就會睇下你係咪真係再中風，或者係你以前有個心臟病咧，我哋即刻睇下你係咪心臟病發。即係呢啲嘢咧係會幫到嗰啲嚟急救你嘅人咧，係會即刻知道點樣做嘅。即係當然你冇，佢哋都應該知嘅，但係可能要長啲時間去查出嚟咯。所以希望大家今日參加完呢個講座之後咧，就去做啲嘢，係嘛？咁咧，首先咧，咁我哋又要多謝呢兩位醫生啦。Thank you to Dr. Raven and Dr. Kwan. We are very appreciative of your efforts. Thanks to the physician and everyone again. Bye bye.